Mother's Day is May 10th. Our next guests know a lot about that topic. HCA Houston Healthcare delivers over 30,000 babies a year across 8 locations. They don't just welcome them into the world, they also nurture babies and their mothers before, during, and after they arrive. Joining us with how their services help give babies the best start in life, from high-risk pregnancy care to helping babies to latch on, is OB-GYN Dr. Bassem Tawadros, Yasmin McDaniel, she's the CEO of HCA Houston Healthcare Southeast, and Tina White, who's sharing her experience with the program. Good morning.
Good morning.
All right. Okay. Before we do anything else, we got to see some pictures of them babies, which are now growing, right?
Yes,
so
ma'am.
there they are. There's your girls, and you have a boy as well, right?
Yes, ma'am.
Okay. So it's like bring your kids to work day. That's what we did right there.
Yeah.
All right. Dr. Tawadros, pregnancy.
Yes.
It's one of those things that we know is the most normal thing in the world to happen. Early man was dealing with it, but it is a vulnerable time. We hear those words, you're pregnant, and then what we have to do to sustain that for the next 9 months.
Yes. Pregnancy can be a very high-risk time in a woman's life. Oftentimes, particularly in underserved communities, pregnancy may be the only time that women interact with the healthcare system. So it's important that we provide an environment where women feel comfortable asking questions, empower them to really participate in their care. And as providers, we need to make sure we're listening to patients and develop that trust, because when a woman trusts her providers and healthcare team, they're more likely to be active participants in their care and follow medical advice.
And that directly impacts outcomes. This happens to be Black Maternal Health Week. High rates of Black maternal mortality. Do we know why? Or I guess we can connect some of the dots, right?
Yeah, I mean, Black maternal health disparities are a significant issue both locally and nationwide. Particularly in Harris County, we see some of the highest rates. Black maternal mortality is 3 to 4 times higher in Black women compared to white women. And 80% of these deaths are preventable with appropriate medical care and early intervention.
Yeah.
Some of the reasons: transportation issues, lack of access to early prenatal care, issues such as child care responsibilities, lack of insurance, work responsibilities. Also, medical factors such as diabetes, high blood pressure, obesity are more common among the Black community and oftentimes left undiagnosed or untreated. And if we address these issues early in the pregnancy, we can make a significant impact on the outcome.
Yeah. All right. Collaborative care model. That's what makes a big difference, Yasmin.
Yes. So with HCA Houston Healthcare, we want to make sure that every mom and baby has a great start. And so that's creating a team of support around them. So at HCA Southeast, we have certified midwives, like the ones that Tina had the opportunity to work with, that work collaboratively with community physicians like Dr. Tawadros, and then we have OB hospitalists that are available 24/7 within our hospital. So at our HCA Houston Healthcare sites, we want to make sure that we're supporting mom from the moment that she finds out that she's pregnant until she delivers her new special treat.
Yeah, and for a lot of us, we think, okay, you find you're pregnant and then you show back up 9 months later when you're in labor, right? But Tina, so we mentioned you have the 3 kids, and the pregnancy the first time around was much different, but you were determined for it to be different the second and third time around. What happened the first time that kind of caught you off guard?
The first time I had a lot of swelling, high blood pressure, preeclampsia is what I found out when I went in for a regular doctor's appointment, and they told me I had to go ahead and get induced because of it. And I just felt like if we were to investigate this before, would we have known?
Because you had questions before, right?
Yes,
you were like saying, hey,
absolutely.
what's the swelling coming from? Well, you're pregnant. That's
Yes.
it, right?
That was not.
That was not y'all.
Not
That was
not
not y'all.
HCA.
Excuse me. That was not y'all. Those are them other people. Okay.
Yes,
Yeah.
not
Yeah.
HCA.
Yeah.
I had my first birth in my hometown, so.
Yeah. And so how did that make you feel? I would imagine it added to the anxiety, because
It
you
did.
know something's going on.
I was just like, I felt like I wasn't heard. I brought it up, and I was just like, the next go round, I'm gonna have to do my research because I want it to go my way.
Yeah. Because Dr. Tawadros, when she's saying, I have the severe swelling, I have the headaches, it's telling you something's going on with her that's not just pregnancy. There's something else in tandem that might not be good, right?
Those are risk factors or signs of preeclampsia, and Black women are more prevalent to get preeclampsia during pregnancy. So it's something we have to be aware and watch out for.
So you're determined next time to make a difference.
Yes,
And
ma'am.
tell us how those pregnancies went.
They went wonderful at HCA. HCA, they were very supportive, as well as my midwife. They took their time and made sure that the plan that I had, they stuck with, and the births were they were great.
Yeah.
At the hospital.
And Yasmin, when she says midwife, I think a lot of people still don't realize that the doulas are available, midwives are available, all these different things that are, it's not just the OB-GYN that you're dealing with.
Right. At our hospital, we have certified nurse midwives. We actually have 4 campuses throughout the southeast area of Harris County. So those certified nurse midwives work in conjunction with, for instance, Dr. Tawadros. He is the medical director for our OB-GYN services to help them throughout their care and make sure they're supported. They actually even come into the hospital and are there at the time of delivery as well.
Because I mentioned, you know, before, during, and after. Because like when we're spit out into the world with our baby and go home, we're like, right? You don't know what to do next. But also helping even with parenting.
Right. Right. So after that, we do have a network of services. Also, HCA partners with March of Dimes, I think, which is one of the ways that we've met in the past. So I had the pleasure of working with March of Dimes with their March for Babies, and continue to work with their board to really make sure that we are supporting the health of all moms and babies throughout the care.
Yeah, you know, and Dr. Tawadros, there are a lot of us who think, okay, do I need to keep showing up to the doctors? Like, I'm not going to drink, I'm not going to smoke, I should be good, right? But there are lots of things that happen that we might not realize. She had some symptoms that she was concerned about. There can be things going on in the womb that we don't know about. That's why it's important to keep those doctor's appointments.
Sure, yeah. Early prenatal care is vital to making sure that we avoid some of these issues and the disparities that we see in the Black community. Yeah. I work really closely with the midwives, and so if there's any high-risk factors that come up during the pregnancy, they're in constant communication with myself. We have MFM specialists that are also available for consultation, and if appropriate, those patients are seamlessly transitioned over to see me.
Yeah, and it can be something as simple as the right vitamins.
For sure, definitely.
All right. Thank you very much.
Thank you.
From planning a pregnancy to delivery and helping moms feel confident every step of the way, HCA Houston Healthcare Southeast can be part of your personalized care team. For more information, visit hcahoustonhealthcare.com. You can also find helpful resources, education, and support for moms and babies at marchofdimes.org.